we know 1 in 7 patients may develop long COVID, we are dealing with millions of people out there struggling with debilitating symptoms. It's going to be a huge health crisis. I'm Athena Akrami, neuroscientist group leader at Sainsbury Wellcome Centre at UCL in London. In the lab, we work to understand how different brains can learn significant structures around them. Last March, my first COVID symptoms started: fever and cough and fatigue. I was expecting them to go away after a couple of weeks. 2 weeks turned into 3 weeks, turned into 4 weeks. I ended up in hospital. They really dispatched an ambulance to take me to hospital. The doctors, including my GP as well as the doctors in the hospital, they didn't know what's wrong with me. So there were no answer out there, and I was just starting to reach out to other people that I knew they were also sick. When I joined the Body Politic Slack group, I spent the whole weekend reading through comments and experiences shared by thousands of other patients, talking about their experiences and lack of any attention or any answer from the doctors. A couple of patients thought that we need to collect data on our own experiences. I immediately wrote to Fiona Lowenstein, the admin of Body Politic Group, and offered my help as a scientist with quantitative background. And Fiona put me in contact with Gina Asaf, who started the survey. And that was the beginning of the whole journey. I remember I worked continuously during sleepless nights together with my husband, Ryan Lowe, analyzing the data. And we put out a report characterizing more than 60 symptoms, including a lot of non-respiratory symptoms, GI issues, neurological and cognitive issues. We talked about brain fog, as well as the impact on the daily life. Most of the participants in the survey were non-hospitalized patients, meaning that they had a mild disease at the beginning, but then turned into real prolonged struggle. The first survey only covered 8 weeks of recovery, but we were suffering from it for many months. So we decided to launch a second survey. The second survey gave us the chance to include more symptoms. This time we included more than 200 symptoms, looking in a detailed way into neurological and cognitive symptoms, also covering mental health. We learned that long COVID involves multi-organs. Like on average, patients have symptoms over 9 organ systems out of 10 organ systems that we studied. And we also show the impact on the daily life and work status of patients over 7 months of recovery. The result from our second study has been now published in the Lancet EClinicalMedicine. 5 of us from the original research group realized the importance of patient-led research because doctors' priority doesn't necessarily match patients' priorities. So we established the Patient-Led Research Collaborative. Different organizations like WHO, NIH, CDC reached out to us, and we presented our work to them in order to bring to the medical community the patient voice. Given the scale of the pandemic and the fact that we know 1 in 7 patients may develop long COVID, we are dealing with millions of people out there struggling with debilitating symptoms. So it's extremely important to take patient-led research seriously in order to fill the gap between the actual need and experiences of patients and what medical community have been focused on so far.